Mental health challenges. What you need to know. Mental health is essential to every part of our lives. It shapes how we think, how we feel, how we connect with others, and how we manage stress. And yet, even today, mental health often doesn't receive the attention it deserves. In 2025, nearly 1 billion people worldwide, one in every eight, live with a mental health disorder. Conditions like depression, anxiety, substance use disorders, and PTSD are becoming more common, touching every family, every community. Mental health and substance use disorders are now a leading cause of disability worldwide, responsible for 1 out of every 6 years lived with disability. And for those with severe mental illnesses, life expectancy is 10 to 20 years shorter, mainly because of preventable physical health problems and a lack of accessible care. In crisis zones and conflict affected areas, the need for support is even more urgent. War, displacement, natural disasters. All these leave scars not just on the body, but deeply in the mind. Studies show that 1 in 5 people living in conflict zones will experience a mental disorder. Children are particularly vulnerable. They face trauma, loss, interrupted education, and emotional wounds that may last a lifetime if left untreated. The COVID-19 pandemic left a long shadow. Anxiety and depression rose by 25% worldwide during 2020 and 2021. And today, healthcare workers, young people, and caregivers continue to struggle under that weight. At the same time, technology has opened new doors. Mental health apps, teletherapy, and online support communities are making care more accessible, especially in remote areas. But they also raise concerns about privacy, quality, and equal access. Frontline workers, nurses, doctors, teachers, humanitarian responders are experiencing unprecedented levels of burnout and trauma. Supporting their mental health is not just compassionate, it's essential for resilient communities. Globally, organizations like the World Health Organization are pushing for change. They call for mental health to be integrated into primary care, for stigma to be dismantled, and for more countries to invest in mental health promotion and prevention programs. Initiatives like Project Hope and NGOs around the world provide crucial support in crisis areas, offering trauma counseling and community education to reduce shame and encourage healing. But challenges remain. There's still a massive shortage of mental health professionals. Stigma silences too many voices, and mental health still receives less than 2% of national health budgets on average. The good news is, mental health is no longer an afterthought. It's becoming a recognized human right, and we all have a role to play. How can we protect our own mental health? We can prioritize good sleep, regular exercise, and healthy boundaries. We can open conversations, listen with empathy, and ask for help early when we need it. Most importantly, we can remember mental health is health. It's normal to struggle sometimes, and seeking support is not a weakness, it's a sign of strength. By working together, by supporting one another, we can build a world where mental health care is accessible, compassionate, and a core part of everyday life. Because mental health matters, today, tomorrow, and for every generation to come. Together, we can make mental health not just a conversation, but a commitment for life.